Hi, my name is Nicole Edmansky. I'm a nurse practitioner student, and I wanted to ask you a couple questions about yourself. So can you tell me about yourself?
Hi Nicole, yeah, my name is Jordan. I'm a nurse practitioner. I'm 32 years old. Ever since I was a little kid, I like taking care of patients and like taking care of people, which in turn led me to wanting to take care of patients. I graduated nursing school in 2015 from Akron University, and then I worked 3 years in the open heart and lung ICU, taking care of patients, and I seen other providers getting a more advanced role, and that led me to becoming a nurse practitioner. I graduated in 2021 from Kent State with my adult gerontology primary care degree.
Okay. And did you work anywhere while you were doing your nurse practitioner?
Yes, I actually worked at Southwood Surgical Hospital as an RN on nights, transition to letting me go to school full time while still working.
Okay. Can you describe your APRN position, including like your specialty, like what you're doing today?
Yeah, currently I work at Southwood Surgical Hospital as an orthopedic nurse practitioner. My day-to-day is in the hospital setting. I first assist the surgeons with total joint replacements, sports injuries, stuff like that. And I also do work in the office setting as well, but it mostly involves hospital in the OR.
Okay. And you do see people in the office as well?
Yes, I do.
What do you do there?
I think it's beneficial to the patients and the surgeon as far as just being able to see a increase in patients. The day-to-day, these surgeons have a hard time getting so many patients in, and it definitely frees them up when you can see post-op patients and allow the surgeon to see new patients.
Okay. Do you see an APRN influence in today's healthcare system? If so, how? If not, why?
Yeah, I absolutely do. I think that APRNs are essential to the evolution of healthcare. I believe that having nursing background and a bedside experience while growing up, it really does help as far as improving the outcomes while advocating for the patients. From your experience as a nurse, you know that we have a different compassion for our patients than certain healthcare providers, just being at the bedside, taking care of them for 12-hour shifts. I think that plays a huge role transitioning to an APRN. Specifically for me in orthopedics, I help the doctors see more patients, allowing the surgeon to schedule more surgeries. When I say that, I mean I get to see, like I told you earlier, post-op patients or patients that are there that are already established, which allows the doctor to see newer patients. I do see new patients, but it allows him to see patients for the first time.
Mm-hmm.
They get established with him, allows him to see more patients, therefore increasing surgeries.
Right. And more people access to
Exactly.
healthcare.
Yeah, I mean, most of the surgeons I work for have to turn down patients just due to full schedules.
Okay.
I mean, it's an immense amount of patients, so.
My next question is, what are some barriers that APRNs face?
Sure, I'm not so sure about barriers. I would say some major challenges that I've seen in the past 3.5 years are just selecting the right role. It's hard to navigate and get acquired in one role with how many specialties there are out there. Just navigating various job options, staying current with all the regulations that are continuously changing is a big thing. But there's so many different avenues you can take after graduation. It's hard to just know what role you're going to be a good fit at first.
Mm-hmm.
So that's.
Okay. And lastly, what changes would you like to see made for APRNs?
A big one that is at the top of the list would just be granted full practice and authority in all states. I know that you have to have a different license for every state and this and that, and being able to get that full practice authority in all states would definitely benefit more patients being seen. They would greatly expand opportunities for APRNs and acknowledge the large amount of services that they have to offer. RNs, they're allowed to practice their full potential in all states, would increase the amount of patients being seen across the country.
Okay. Well, thank you so much for meeting with me and taking time out of your day. I know you got to get back to surgery, so
I
I'll
appreciate
hold
it.
you up. Thank you.